Good morning, my name is Jessica Porter and I'm a licensed professional counselor and therapist. My practice resides in an inpatient mental health treatment center in Dallas. My first job is to make my patient feel comfortable by earning their trust so that I can assess them and diagnose so we can get to the root of the problem. My ultimate goal in providing care for my patient is not only to have the reduction in symptoms, but to learn a new way of thinking that leads to feeling better and living better. Helping my patient to better understand and cope with their thoughts, feelings, and behaviors will get them to this goal. Bipolar disease is a mental disorder that is not as common, and can sometimes be hard to diagnose. Out of 100 patients, 3% of my patients are diagnosed with bipolar disease. Common symptoms to look for are extreme highs and lows in their behavior, meaning a patient can experience depression but also experience mania. Additionally, paranoia and anxiety can be symptoms of bipolar disease. When the patient is manic, the person will tend to behave more impulsively and take significant risks that can put them in danger. During this time, a person is in manic states does not realize the negative consequences of their actions. Depression is the low part of bipolar disease. They may be obsessed with feelings of loss, personal failure, guilt, or helplessness, which can lead to thoughts of suicide. The depressive symptoms will interfere with the patient's ability to function. Other signs to look for is fatigue, loss of appetite, insomnia, loud rapid speech, reduced slow speech, and attention deficit disorder. Post-traumatic stress disorder can also be related to the mental illness. Bipolar disorder can be managed in some ways. Cognitive behavior therapy, as well as the patient learning self-management strategies, can educate him or her on the mental illness and help them to become aware of symptoms early on. Medications such as mood stabilizers, antidepressants, and antipsychotics can help the patient take control of their thoughts. Depending on the severity of the symptoms, a patient may not need to be treated with medication. When moods are not as extreme, they may be able to manage with therapy. Ways of living, self-management, and low doses of medication. In this case, the patient will not meet the criteria for bipolar disorder 1 or 2. The nature of treatment highly depends on how extreme and often their manic depressive episodes occur. Patient RA is a 30-year-old white male who is a missionary in Mexico, making his socioeconomic status extremely low. He has a history of depression, ADHD, insomnia, and paranoia, dating back to a teenager. As the years have progressed, his symptoms have become more extreme. He is on a number of mood stabilizers and sleeping pills to help him get through the day. Within the past month, behavior therapy has benefited him a great deal, as well as taking up more physical activities such as running. With RA, I have noticed that learning new techniques and how to cope with his mental illness has made the patient's life more bearable. The National Alliance of Mental Illness can help provide resources as well as support for an individual with bipolar disease. Also, helping a patient identify triggers or stressors can help an individual manage their illness. Additionally, when the patient keeps him or herself active, establishes a routine, avoids drugs and alcohol, and gets rested sleep, it can prevent a severe episode. The key to this mental disorder is to provide as many suggestions and support to a patient as possible. Today, one major problem is that it is misdiagnosed, and the severity of this mental illness should not be taken lightly. Thank you.